and we'll see if I can juggle this whole technology thing. I will really try for you guys, I promise. All right, so this is the PowerPoint. Hopefully you guys have that minimally accessible. I'm gonna try to do this in such a way that it'll mimic me drawing on the whiteboard for you guys. As always, we have these muscle terms, right? So essentially helping you to translate the muscle terms that we're going to learn so that you kind of have an idea what you're looking for before you can see it. What is relevant for us now, do this every time, all right, are the orbicularis muscles. So note like orbit, right? You orbit around the sun on the earth, and so these muscles literally orbit around, as we'll see, around your eyes as well as around your mouth. Let's see, nasalis, right? Sounds like nasal. Nuchal, right? The back of your neck, and so on and so forth. So just as always, these terms are going to be helpful for you guys to translate the muscle names. All right, the first muscles that I want to point out for you guys are the extrinsic eye muscles. And so they're extrinsic because they're attaching to the outside of your eye. Next week in lab, you're going to learn about this model right here. But before you actually look at the model, I do want you guys to be a little bit familiar with how the eye moves in all sorts of different directions. And as far as muscles go, I think that these are probably the 6 easiest muscles that you're ever going to learn on the human body. They just make so much sense. Okay, so the extrinsic eye muscles, the ones that are moving your eyes in any direction, are either straight or they go to weird angle, right? So there's something rectus, right, meaning straight, or there's something oblique, meaning at a crazy angle. So we'll look at the rectus muscles first. We actually have 4 of these extrinsic eye muscles attaching to the outside of the eye. 1 on the top, 1 on the lateral side, 1 on the medial side, and 1 underneath. And so the superior rectus, right, is right here, right? See that it's attaching to the superior side of the eye. This is the insertion, so this is what is actually being moved. Okay, and it's, again, on the top. The medial rectus we can't see in this particular image. It would be, way back here. And essentially that is closest to the nose, right? So in this model / diagram, we're looking at the right eye. And so the medial rectus on the right eye would be on the medial side. Okay. The lateral rectus we can see right here, right? Note that the origin is way back here around what, hopefully we know now is the optic canal, right? And the insertion is all the way here on the lateral side of the eye. Okay, and finally, the inferior rectus is right here. So again, straightforward origin around the optic canal, insertion on the inferior side of the eye. Okay, does that make sense so far? Is that okay? I guess speak if you have a problem. If not, I will continue.
Yeah, sorry. I just realized you were using a pen to circle stuff, so I didn't realize what you were talking about.
Gotcha. Yeah, so I'm gonna try to use the pen as if it was a whiteboard marker. So what we've seen so far are the 4 rectus muscles: superior on the top, inferior on the bottom, lateral on the outside, medial on the inside, right? And these are the straight muscles.
Mm-hmm.
All right. The oblique muscles. All right, we'll start with the inferior oblique because it's really easy to see. First, we have the insertion, right, all the way on the lateral side of the eye, and the origin is way over here next to the nose. If we were together in person, we'd learn all about the origins and insertions, but because we're not, just know where they are and what they do. That's all for this particular exam, okay? All right, so this here is the inferior oblique, right? It goes at some kind of a wacky angle. And finally, the superior oblique, again, originates around the optic canal. We can see it go forward, forward, forward. It actually passes through this structure right here, which is called a trochlea. So similar to what you have in your elbow, this is an hourglass structure. In this case, the superior oblique passes through the trochlea, does an about face, and inserts on the eye right here. All right, so we can see that this is just a weird angle. It changes direction literally right in the middle of it. Okay, so again, that is the superior oblique. Okay. Any questions about that?
We got muscles on our eyes?
Yeah, isn't that crazy? Right, we move our eyes, so.
I didn't know my mic was on. Oh.
Yeah, yeah. And luckily they're pretty straightforward.
Yeah. Is this PowerPoint gonna be uploaded once we get finished going through it?
So it is uploaded right now.
Oh, okay.
So in the little Zoom message that I told you guys about this meeting this morning, it is an attachment on that.
Okay.
Okay. All right.
Will we be able to see like you teaching through it again after we're done Zoom? Like, is there a way to upload this interaction?
In theory, I will do my best. I cannot promise that I'm going to be able to wield technology to our advantage in that way, but I'll do my best.
So there is a way. It's recording right now.
Yes.
Because my chemistry teacher has been trying to get the same thing going. I don't know what she did to get it to roll, but it works.
Awesome. So if I have trouble, I'll call IT. Hopefully it'll work out okay. But either way, we get to hang out here this morning together. All right. All right. So as I said, what's important for this lecture exam is where is it and what does it do, right? We're not worrying about origins and insertions. You know, we have to cut something out. So where is it? What does it do? And so what I want to do at this point is to look at, I'm pointing to the eye on the screen like you can see that. So I want to look at this eyeball. This happens to be a right eye. And here we can see the superior oblique. We can see the inferior oblique. And we can see the superior rectus, the medial rectus, lateral rectus, and inferior rectus, right? So we can see where all of these muscles are actually attaching to the eye. Keep in mind that the rectus and superior oblique muscles are going to originate way back here in the back of the orbit or in the back of the eye socket. That is around the optic canal. And so essentially they are pulling these insertions back towards the origins, and that's going to give rise to the action of these muscles. All right, so at this point, I want to change colors again. Just write in what muscles are producing, you know, the eye roll or like, you know, looking at your nose or any of those kinds of things. All right, so if you were to look,
right eye.
Sorry, what was that?
How can we tell that it's a right eye?
Because I told you, and because the inferior rectus inserts on the lateral side of the eye, that means this must be the lateral side of the eye.
Okay.
Yep.
Thank you.
Yeah, no worries. Thanks for asking. All right. So again, if you were going to look straight up at the sky, you would use two muscles. You would use your, let's see, your superior rectus and your superior oblique. All right, so I'm going to abbreviate these things. Superior is S, right? Rectus is R, O for oblique. Okay. If you were to look up and laterally, so in this case up to the right, you would use only your superior oblique. If you were to look up and to the left, you would use only your superior rectus. If you were to try to look at the bridge of your nose, right, so looking medially, not down towards your nose like a normal cross-eyed, but truly medially, you would use your medial rectus only. Right, a true cross-eyed, so trying to look down at the tip of your nose. I don't know if you can see my eyes, but I'm trying. So down and towards your nose, you would use your inferior rectus. Okay. You look straight down to your toes. You would use your inferior rectus as well as your inferior, oblique.
So each like wherever you look has a different part of the eye that I don't know what I'm trying to say. So basically each of them have what they do with, like, if I'm trying to look at the left, I only use certain muscle.
Correct.
Is that how I like to work or something?
Exactly. Just like with, with your arms, right? Like if you want to flex at the elbow, you use your biceps brachii. If you want to extend, you use your triceps brachii. The same thing with your eyes. If you want to look to the left, right, your right eye is using its medial rectus to look to the left, right? If you look to the right, your right eye is using the lateral rectus. Okay, so the same exact things that we've been talking about in the joints.
I can't help but feel that the muscles used to move up and down are, I feel like the diagonal muscles should be using both, and the up and down should be using singular. That's the other way around.
It is the other way around, yeah. And so that's actually a great point. Your optic canal back here isn't directly to the back of your eyes. It's actually a little bit medial, right? And so all of your rectus muscles aren't just pulling, like straight up. They're pulling up and in, right? So it's a little bit wonky. Hopefully,
actually, that makes so much sense now that you say that, because like I can visualize it. I can figure out. It makes sense visually to me now.
Yay! One of the many reasons why we're doing this face to face today.
Yeah, otherwise I'd be really lost.
Yeah, it's a little bit tricky, but you guys have learned harder muscles before, so you got this. Okay, all right, 2 more directions. Oops, not that. All right, if you are looking with the right eye down and to the right, so down and laterally, you are using your inferior oblique. And finally, if you're looking directly to the right, you are using your lateral rectus. Is that good? Any questions? I lost my chat here, but all right, very good. Moving along. All right. If it's weird to think about the fact that you guys have eyes on the outside of your eyes, maybe it's even weirder to think about the fact that you have muscles in your eyes as well. And that is absolutely the case. In fact, when you talk about your eye color, you're actually talking about what type of pigment and how much pigment is in a muscle, or actually 2 muscles, of your iris. Right? So your iris, your eye color, is a pair of muscles. Okay? And so this first image up here is showing us your pupil, right? And so it's not colored, it's just muscle colored at this point. There's no pigment, it's not brown or blue or green or whatever. Your pupil is actually adjustable, as you guys know, to allow lots of light in, right? So if it's dark in the room, you're gonna let lots and lots of light in. If it's really bright outside, right, you let just a little bit of light in so you don't burn out your retinas. And so there are 2 antagonist muscles that actually complete these tasks. First of all, we have the dilator pupillae. As the name suggests, this is the part of your iris, right, the colored part, that actually dilates your pupil to let lots and lots of light in. Okay, these are the radial muscles, right? So they are literally pulling the edge of your iris, or I guess the edge of your pupil, out to open up the pupils. Okay, so that's your dilator pupillae. The constrictor pupillae is one of those orbicularis muscles, so it orbits around the edge of your pupil, and when it contracts, it decreases the size of that muscle. Right, so these are the circular muscles, right? The constrictor pupillae, and the dilator pupillae are the radial muscles. Okay. All right, one last set of muscles, and this is literally in your eye. If we were to take a section through the side of your eye, what we could see is the cornea, right? So if you wear contact lenses, this is where your contact lens would go. This is where the light is focused into your eye. Behind the cornea, as we'll see more next week, is the lens, right? And this lens, its job is to literally focus the light specifically on your retina, right? If you focus it on the wrong spot, you become either nearsighted or farsighted. Right, so it's really important to kind of mold this lens to focus the light exactly where we want it to be focused. And so the way that we do that is we constrict what is called a ciliary muscle. Okay, so the ciliary muscle goes all the way around the lens. Here we see it in cross section, but the little ligaments attach to the lens and they pull it to make it really thin or make it really fat. And so this image over here is showing you kind of the opposite movements of this muscle. First of all, in order to look at something really close, right, like you're all looking at a screen right now and it's really close, what your ciliary muscles are doing is they are contracting, right? So that would be this circumstance over here. They are contracting, therefore pulling the lens to be really fat so that we can focus a really close object, thus, you know, your computer, your tablet, your phone, on your retina back here. Okay. If you look up from the screen, you look across the room at the wall, what's going to happen is those ciliary muscles are going to relax and therefore allow that lens to get a lot skinnier, right? So that will focus on the far away part of the room. Now you guys might have noticed before that after you're looking at the screen so very much, which I know is part of your lives so much right now, but you're looking at the screen, and when you look up from the screen, it's kind of blurry in the background. Essentially what's happening there is that your ciliary muscles are contracting for so long so that you can focus on whatever you're looking at so close that when you look up, they have a hard time relaxing, right? So your ciliary muscles actually become locked into place. And if this happens, you know, for, you know, months, years at a time, without actually exercising your eye, yes, it is a muscle, without exercising it, without looking far away again, you might become nearsighted, right? Those ciliary muscles might not work the way that they're supposed to if you're constantly looking up close. And actually, I gave you guys a link down here. So end essentially nearsightedness. This is some simple exercises for actually exercising your eyes so that in this crazy time when we're all so dependent on screens, you don't hurt your eyesight. All right, so just a little bit of reading for your own interest. All right, any questions? Okay. All right, so here we get to muscles of the face. What I have done is, on the notes I have in front of you now, I have taken part of the list that I gave you for lab, and I've slapped it up on the screen so that you don't have to try to read my crazy finger painting on the screen. All right, so the first muscle we have is the occipitofrontalis. Occipito meaning the occipital bone way in the back of your head, frontalis meaning your frontal bone. And so this muscle actually spans the entire length of your head. As we've seen before with, for example, the coracobrachialis, the first half of the big scary word is the origin, and the second half of the big scary word is the insertion, which means that this muscle is pulling your forehead, essentially your eyebrows, towards the back of your head. And so some of you guys have seen this before, I'm sure. Some people have this crazy ability to like move their entire scalp, right, when they raise their eyebrows. That is because there's a lot of connective tissue between the occipitofrontalis and their scalp. Right? So that's variable from person to person, but in general, whenever you raise your eyebrows, that is happening from the back of your head. Okay, so action of the occipitofrontalis is to raise your eyebrows. Where is the occipitofrontalis? It is right here. So this is the frontal belly. All right, we can see it, you know, extending back over the scalp here. Here is also the occipitofrontalis, the frontal belly. It extends over the top of the head, ultimately originating back here on your occipital bone. Okay, so occipitofrontalis raises the eyebrows. Okay. All right, the next.
Possible to write the corresponding number on the muscle, that way like I can take a picture of it like once they're like all numbered. Yeah, thank you.
Awesome, no worries. Oops. All right, so I'm trying to change some colors here so it's not too confusing. All right, next, the temporalis. As you might imagine, the temporalis is over your temporal bone. And so what we can see here, is the temporalis. Okay, a little bit difficult to see here, but it actually passes under your zygomatic arch. So this cheekbone right here, this is the zygomatic bone, this is the temporal bone. They join together to make the zygomatic arch. And so the temporalis actually goes underneath, right, or actually medial to the zygomatic arch to insert on the mandible. And actually what this is doing is it is pulling the entire jaw up. Right? So when you take a bite out of an apple or something, your temporalis muscle is pulling your jaw up, right? Closing your jaw, closing your mouth, or elevating the mandible. Okay. We can also see the temporalis over here. Okay. All right. Next, we have the orbicularis oculi. Right, so if you look farther down, number 7 is also an orbicularis muscle. Remember I told you orbicularis literally orbits around something. In this case, it orbits around the oculars. Right, so oculi means ocular or eyes. Right, so this here, that's not very visible, but this is the orbicularis oculi, and there's one around each eye. Next, we have the corrugator supercilii. Right? It's a kind of a crazy long word, and I emphasize the fact that there's 2 eyes on the end of supercilii. If you've ever looked at the edge of your Amazon box when you open it, you'll see that there's a smooth layer of paper, and inside there's that wavy layer of paper. That's called corrugated cardboard, and so corrugation is literally waviness. So what the heck is that doing here? Well, this particular muscle is right here under the medial side of your eyebrows. And so when you contract this muscle, you are pulling your eyebrows closer together, right? So literally you are corrugating, you are furrowing your brow. So this is the grrr, the dog peed on the carpet muscle, right? So lots of waviness in your brow in between your eyebrows. Okay, so again, this is number 4, corrugator supercilii, the grrr, the wrinkled part of your brow. Okay. All right. Next, the zygomaticus muscles. These muscles, as the name suggests, are attaching to your zygomatic bone. And so if you remember, or if you've gotten to watch the lab videos yet, you might know that the pointy part of your cheekbone is called your zygomatic bone. And so both of these muscles are going to originate on the zygomatic bone. The medial muscle, all right, so this one right here, oops, sorry, that's my email, is the zygomaticus minor. One's not mine. Puppy.
Sorry.
All right, so zygomaticus minor. This is sometimes called the Elvis muscle because it pulls the lip up and to the sides. And so I'm going to try to do this without smiling or laughing, but again, pulling the the middle of the lip up into the side. So this motion right here is the zygomaticus minor. And if you know about Elvis, you know that that was totally his thing, right? All right, next, the zygomaticus major is the more medial, or sorry, the more lateral muscle here. So zygomaticus major, this is pulling the edge of your mouth, right? So more or less the corner of your mouth, not only laterally, but up to the side. So the zygomaticus major is your true smiling muscle. So up and to the side is the zygomaticus major. Okay. Does that make sense so far? Shame, you guys get to watch me humiliate myself and make faces to you, but I don't get to watch the same in return. That's okay. Anyway, number 7, the orbicularis oris, right? Orbits around the oris or the oral region. So this muscle here is the orbicularis oris, number 7. Okay, this muscle helps you go ooh, right? So when you contract it, it pulls your entire mouth together, so you can say ooh. Okay. Next muscle is the a muscle that is pronounced so many different ways, but the buccinator or the buccinator, essentially the space in between your teeth and your cheeks is called the buccal or buccal cavity. So the space there. And so this particular muscle is actually in your cheeks. It happens to be a fairly deep muscle, so we can't see the entire thing on this diagram, right? But the fibers run in this direction. If we look up here, we can see it, again, pretty deep to the other muscles, right? So this here is the buccinator. Essentially, this keeps the food that you're chewing actually in between your teeth, right? So if you've ever gotten Novocaine in your mouth, so you've ever gotten a filling or whatever done, you might notice that you can't really control your cheeks very well. And so if you try to eat before the medicine wears off, it's really hard to keep food actually in between your teeth. It just kind of like out to the sides of your cheek, which is why they tell you not to do that, of course. But this muscle, again, pushes the food in between your teeth, right? And so if you use it enough, of course, this can help you make the little fish face. So that is the buccinator or buccinator. Okay. Next. The masseter. This muscle is for mastication or for chewing. So it is a synergist of the temporalis muscle. Actually, I should change the color there. It's very close. So if we look here, we can see that there is a pretty flat muscle, origin on your cheekbone, insertion on the bottom of your mandible. And so this muscle, again, pulls your mandible up, right? So this helps you to take a bite of an apple. Okay. Over here as well. So this is the masseter number 9. Okay. The most superficial muscle in this particular region, so in the region of your cheeks, your buccal region, is called the rhizorius. And if you reference that chart that I gave you in the beginning of this PowerPoint, you'll see that rhizorius is indicating smiling, some kind of smiling. And so this squiggly muscle right here, right, which we can also see on this side, a squiggly muscle, this is called the rhizorius. Right? So I told you that the zygomaticus major was the true smiling muscle. This is kind of like the fake smiling muscle. Right? So if you tell your nieces and nephews, "I'll smile for the camera." Of course, they don't want to smile for the camera, but to appease you, they will do this really fake smile. So they'll pull the corners of their mouths back towards their ears, but it will look fake, right? So this is rhizorius, but a true smile is zygomaticus major. Okay. All right. Next, we'll do the mentalis. All right, as the name suggests, this is in the mental region, and so what we have here are 2 muscles in the chin region. All right, this is number 11. All right, so these look kind of weird, and the reason they look weird is because they actually insert on the skin of your chin. And so when you contract this muscle, you can do two things. First of all, contracting the skin of your chin actually pushes your lower lip up and out. So this is mentalis. Also, when you contract this muscle, if you ever looked at yourself in the mirror when this happens, you'll notice that the skin on your chin is very wrinkly. So wrinkly skin on your chin and protruding your lower lip is called the is produced by the mentalis. All right, almost done with this image here. Levator or levator labii superioris. Again, a really long, complicated word. As the name suggests, this muscle elevates. Labia is lip, and what lip? The superior lip. And so this muscle is actually a little bit deep to the zygomatic muscles. All right, so this right here elevates the upper lip. So levator labii superioris. Okay, let's see, the antagonist to the zygomaticus major is the depressor anguli oris. And I think it's easiest to see over here. Up at the top, here we have the corner of the mouth as the insertion, and the origin is the bottom of the mandible. All right, so I tell you that because the corner of the mouth is pulled down. Right, so this is the depressor anguli oris. We depress or we pull down the angle anguli oris of the mouth. Again, where is it? What does it do is important for this exam. Final muscle to talk about here is the depressor labii inferioris. All right, so again, depressing. What is it depressing? What is it pulling down? The labii, the lip. And which lip? Not the superior lip, but the inferior lip. All right, so here we can see muscles that are running laterally. Depressor labii inferioris. So this helps you to pull your lip down so it's a little bit pouty, but if you want to do a full-on pout, like Mom, I really want ice cream pout, it is the mentalis. Any questions about any of those? Well, before I move on to the next slide. Or if you need to take a screenshot or something, now's the time.
Way ahead of you.
All right. All right. Moving on, unless someone shouts to not move on yet.
Hold on 1 second. Let me take a screenshot.
Okay.
Just want to take a little picture.
Take a little picture.
Right. And wait, what is this?
Good.
Yep.
All right. All right. So we've seen a lot of these muscles already, and this list I just stole at the last slide. But let's go through what we already know. This muscle right here on the corner of your jaw, all right, pulls your jaw up so it elevates the mandible. That is called your masseter. So your number 9, the masseter. Okay, and I think that's all we can see from here. This is actually your trapezius. Let's see. Trapezius is not on this next exam, by the way. Sternocleidomastoid, probably a favorite among all students. Hooray. Sounds big and fancy, but really tells you exactly where it is. Sternocleido is the first half of the compound word. So on the sternum, right here, and cleido means clavicle. So here is the origin. And mastoid, we have a mastoid process of the temporal bone. In fact, if you feel right behind your ear, if you feel that like bump of bone, that is your mastoid process. And so that is right here. This is your external acoustic meatus, so your ear canal. And this muscle right here is your sternocleidomastoid. Right, so you have one on each side. All right, so when you contract insertion towards origin, you are essentially pulling the back of your head towards your sternum and clavicle. So what does that look like? Well, if you contract both of these muscles at the same time, you put your head straight up, right? So if you are going outside and catching raindrops in your mouth, you would go like this, and that is your sternocleidomastoid. Also, if you turn your head to the side, you can see here is the origin all the way up behind your ear. That is this is the origin, this is the insertion. So this is your sternocleidomastoid. If you contract only one of these muscles, you can kind of sway your head back and forth listening to music or something. All right, so this is sternocleidomastoid and that is sternocleidomastoid. Okay. And as always, you should be kind of using these muscles to figure out what they do, where they are, etc. And no one even has to see you do it. All right, number 17, the digastric. Di meaning two, gastric meaning bellies. So this muscle has two bellies. And so this muscle right here passes through yet another trochlea on this bone, the hyoid bone. And so the digastric is important, excuse me, in depressing the mandible. All right, so we've talked about the masseter, we've talked about the temporalis, and both of those muscles close your jaw, so they close your mouth. The digastric opens your mouth. Okay, so it's going to pull your chin down in this direction. Okay, so that is number 17, the digastric. Okay. There's one more muscle that's not, that's not visible on anything, but we know that it's there. We can see it through the skin of our neck, and that is the platysma. Okay, this muscle is super flat, and it kind of blankets over your entire anterior neck. Origin on your clavicle, insertion on your jaw. And so if you lock your jaw and you contract this muscle, what you will see is this. That is your platysma. The don't put your feet on the coffee table muscle. That is your platysma. Okay, so again, it blankets over everything. All of the muscles that you see on your screen right now are covered by the platysma. Right, so this muscle blankets over everything. If you don't lock your jaw, the platysma is a synergist with the digastric. It helps you to open your mouth. Okay. Any questions about those muscles? All right, moving down. All right, the next set of muscles are the pterygoid muscles. So number 18 here are the pterygoid muscles. These muscles can't be seen on the outside of the face, but we can see them here. All right, this is the masseter pulled away so that we can see. Also, the zygomatic arch has been removed so that we can see these muscles. They are all called the pterygoid muscles because they attach to the pterygoid processes of the sphenoid bone. If we were to look through the back of the skull, right, here is your cranial vault. This is where your brain would be. Here is your nasal cavity. So where you're inhaling right now, and flanking either side of your nasal cavity are these extensions of bone. Change color here. All right. These are the pterygoid processes. This is the back of the sphenoid bone, so there they are. All right, so what we can see here is that the origin of all of these muscles, a whole bunch of them, is on the pterygoid processes, and the insertion is on different parts of the mandible. And so we can not only open our jaw, close our jaw, but we can also move it side to side. That is happening because of the pterygoid muscles. And I do want to show you a little bit of these muscles working. All right, so hopefully what you can see, this is a dentist talking, and what we can see here is whenever the teeth are touching, they turn blue. Whenever they are not touching, they turn white. Right, and so what we can see up here are the pterygoid muscles. They're actually moving the mandible, not only, you know, just up and down to chew up and down, but also they are moving the mandible back and forth. Okay, and so that's actually unique to mammals. Like a crocodile can't chew you, they can bite, but they can't chew. And so this grinding motion really allows mammals to break down their food a lot more than, you know, a bird could before you actually swallow it. Okay, so again, those are the pterygoid muscles. I should keep pointing at the screen like you can see that. This here is the masseter, and the pterygoids are behind the masseter. Okay. Does that make sense? Any questions about that? Okay.
Wait, you said the pterygoid muscle is not the big muscle that's in the front of the jaw? Which one is the pterygoid muscle?
So this is the masseter right here.
Okay.
Mastication. And behind it, so if we zoom in on the TMJ, the temporomandibular joint, right, so TMJ, we can see these muscles working, and they're almost like pulling the mandible out of its joint, and they're moving it back and forth. All of that movement is produced by the pterygoids.
Okay.
All right, let's see if I can. Okay. So again, the pterygoids. Okay. All right, so crazy to think of muscles on the outside of your eyes, crazier to think of muscles inside your eyes. These are your tongue muscles. Right? And so I know a lot of you guys are interested in speech, and so maybe you guys already know about these things, but very brief overview of the extrinsic tongue muscles. So these are the ones that are moving the entire tongue. They're not helping you to move like the tip of your tongue. It's just, is your tongue at the roof of your mouth? Is it sticking out? Is it all the way at the back of your mouth? Like moving the entire tongue. And so just to give you a little bit of perspective here, let's see. This is the front of your mouth. Here are your teeth. This is your mandible. Here is the palatine bone making up the back of your hard palate. Here is part of, oh my gosh, sorry, the maxilla. This is the maxilla. This is the mandible. This is the palatine bone. Here's your tongue. And all the way back here is your external acoustic meatus, so your ear canal. And sticking off the bottom of the temporal bone is that super pointy styloid process, the third and final styloid process that we're going to learn about in this class. Also, we see the mastoid process with the sternocleidomastoid attached. All right, so just a little bit of perspective there. All right, so filling the majority of your mandible, okay, is this muscle called the genioglossus. This helps you to depress your tongue, so to pull it down away from the roof of your mouth, and to protract your tongue. So if you're going to stick your tongue out, you are using your genioglossus to essentially stick your tongue out. Okay. The next muscle here is the hyoglossus, and hyo is indicating the hyoid bone, and so we can see this is the hyoid bone. It's the only bone that is not attached to any other bone within your body. It's part of your larynx, right? And if you're a speech person, you will learn all sorts of things about the hyoid bone, but here, the hyoid bone is the origin, the insertion is the base of the tongue here. So the hyoglossus is responsible for, of course, depressing the tongue, right? So pulling it down, as well as retracting it, right? So you stick your tongue out with the genio, you pull it back into your mouth with the hyoglossus. And just to note, glossus means tongue. So anytime you see glossus, or lingual, both of those mean tongue. Okay. Next, we have the styloglossus. All right, so remember that this here is the styloid process. Okay, so styloid process is the origin, and this entire muscle here is the styloglossus. Okay, the styloglossus is again responsible for retracting the tongue, but instead of pulling it down like the hyoglossus, it pulls up towards your ear, and so this helps you to elevate your tongue towards the top or the roof of your mouth. The last one is the palatoglossus, and so this one is different because it originates on the soft palate. Right, so if you run your tongue over the roof of your mouth, you'll feel like those little ridges in the front right behind your teeth. That is part of your maxilla. Farther back, that is your palatine bone, and then at the end of the bone, you feel that like squishiness right at the back, almost into your throat. That is your soft palate. It is a muscle. It helps you to not send Pepsi up your nose, making sure it only goes down your throat instead. And so when you swallow, the palatoglossus is going to contract as well. It both depresses the soft palate, right, making sure that no food goes up your nose when you swallow, and also it is going to elevate the tongue, right? So whenever you swallow, you can feel your tongue go up to the back of your mouth. It kind of pushes against the soft palate, making sure that food goes this way, right, up and out of the mouth and down your pharynx. Okay. Do you need me to repeat any of those muscles at all? No? Okay, very good then. So those are the main muscles I want to get through this morning. Usually I have a little class assignment for you guys. We can just walk through it together. This is kind of reflective of what exam questions would look like on this particular content. So here's Jim Carrey, probably the most facially expressive person I could possibly think of. Hopefully these movies aren't too old for you guys. Oh my gosh, one of these years that's going to happen. But anyway, in the mask, what type of, or what muscle might the mask be using to raise his eyebrows? Okay, so raising them up, just a hint, pulling from the back of his head. It's what pulls his eyebrow.
Would it be the orbicularis oculi?
What was that?
Would it be the orbicularis oculi? I don't know how to say it.
Orbicularis oculi, that's a good thought. Orbicularis oculi goes around the eyes, and so when it contracts, it helps you to close your eyes. Okay, so.
Could it be I'm sorry, go ahead.
Oh, go ahead.
The occipital frontals.
Very good, very good. So the occipitofrontalis, so he's pulling from the occipital bone to raise his eyebrows. Good, so occipitofrontalis. You guys have that? Do you need me to write it down? I can do that. Okay. So that one, it's also called the epicranius, but I think occipitofrontalis makes a little bit more sense. Okay. What might he use to open his mouth? There's kind of two ways you could go here. When you open your mouth, you're not only opening your lips, but you're opening your jaw. So what is a muscle that might depress the jaw?
Depressor, lady. Never mind.
So absolutely. So assuming this is one you were going for, depressor labii inferioris. So that is going to open the lips. So pulling his lower lip down, and absolutely that is happening.
Oh, so that was right.
Anything else?
The digastric.
Perfect. So the digastric is important in lowering the jaw, depressing the mandible. Right? So he's not only pulling his lips down, but he's also pulling his jaw down. Good. Is there another muscle that might depress the jaw? the muscle, right? The platysma, right? If you don't lock your jaw, it helps you to open your jaw. Okay. All right. How about sticking out his tongue? All right, so there's only one muscle to stick your tongue out and a couple to pull it back in.
The genioglossus?
Genioglossus, perfect. At least for our purposes, right? If you're in speech, you'll learn a lot more detail about those for sure. All right, so does that make sense? Is that good for you guys? All right, do you want to go through the next one just because it's good practice? Me? All right, we're gonna do it.
Sure, why not?
Okay, we're gonna make it happen. All right, depressing his chin, right? So, in this case, he's not pulling his lip down necessarily. We'll get into that in a second, but what is being used just to pull his jaw down? Okay. Same ones as before?
Mm-hmm.
Okay. What would be used to elevate his jaw, right? To take a bite out of an apple, just for review's sake.
Ella, you just said it. Would it be the, oh, I know it starts with like levator or something. Oh, levator labii superiosus.
Can you say that one again?
Oh, sorry.
That's okay.
I was saying, would it be levator labii superiosus? Number 12?
So that's a good thought. So let's see. We can put that one up here actually. So levator or levator, labii superioris. Those two muscles, depressor and levator, are pulling the lips in opposite directions, right? So when he opens his mouth to stick his tongue out, he's probably also lifting his upper lip as well. We can see that because we can see his teeth. So that's great to lift his upper lip and bring his lower lip down. All right. But for this question, to actually close his jaw, so not working on his lips, but working on his mandible itself.
Oh, sorry. I heard I heard you say elevate somewhere. That's why I said that. Sorry.
Oh, yeah, no worries, no worries. So to elevate the jaw, as opposed to the labia of the lip, the jaw, we can use the masseter, right, for mastication, for chewing, or we can use the temporalis. Right, so when you do chew, you can kind of feel your temples like coming in and out. Right? Mm-hmm. So when you're chewing like something, you know, really sticky, really hard to get through, you can see your temples moving, and that's because your temporalis is moving. Right, so this one is to close the jaw. Right. Sticking out his lower lip. Right. Also note that his chin skin is pretty wrinkly. Right. So what is the main muscle that would do that?
Mentalis.
Perfect. Mentalis, right? The mental region, right, in the chin, and it wrinkles the skin of his chin. Beautiful. All right. Oh, we didn't even go over this one. Oh my goodness. Well, interesting. So this wasn't on your list, but for the sake of being thorough, palpebrae superioris. So actually, if we go back to the eyes, what we can see is, gosh, sorry about that, guys. I forgot all about this one. In the eyelid, there is yet another muscle. All right, this isn't acting on the eye, it's acting on the eyelid itself. It helps you to open your eye, whereas the orbicularis oculi closes your eye. This muscle is called the levator or levator, and I'm going to type this in so you don't have to read my chicken scratch here with my finger. The levator, it elevates. What does it elevate? The palpebrae. All right, so palpebrae are your eyelids. And which eyelid is it elevating? The superior one, superioris. Okay. All right, so sorry about that one, guys. Opening the eyes, levator, palpebrae, superior. All right. Any questions about this, about how I could ask the questions? Any other content in the last like 3 minutes that we have together? Okay, well, that is all I wanted to absolutely get through today. I will post an anonymous survey on Blackboard if you want to give me any other kind of feedback that you didn't want to express to the rest of the group and you didn't want, associated back with you. Again, anonymous survey will be posted hopefully today, minimally by tomorrow. I will grade the open-ended part of your exams as quickly as physically possible. And there will be YouTube lectures posted starting for Friday. You can watch them whenever you want. I will give you class assignments every once in a while to earn credit. You did earn credit for being here today, so thank you guys so much for showing up and waking up early and watching my funny facial expressions. I'm gonna hang out here for a while. If you want to, stay in chat and ask questions. Also, as you can see, I'm in the lab, so if you have any questions about the models, I can physically show them to you and we can walk through them together. But at this point, that is the end of content for this morning. And so thank you guys so much. I really hope that you're doing well and staying strong and safe and healthy through all of this. So have a good day, guys.
I have a question.
Sure.
Will we be having like online homeworks too? I mean, like, you know how we do the smart, what is it? It's not smart work. What is it? Huh?
So mastering AMP?
Yes.
Yeah, so there will be more mastering homework posted this week. I'm hoping that that's still helpful. I'm also hoping that you realize that a lot of the exam questions came directly from mastering, so it really is in your best interest to do that homework and practice, and frankly, you'll see a lot again.
Okay. All right. Thank you.
Yeah, no worries.
Wait. Will the schedule be posted? Will the schedule be posted like sometime today to let us know what's coming up next as far as like what we went over today and all of that?
Absolutely. Yes, I will get that. I will get that pumped out and put up onto Blackboard this morning.
Okay, and then one more thing. I'm sorry. I know everybody probably got questions.
It's all good. This is great. I'm so glad to hear your voice, like, not kidding.
Thank you. So is that, because I see that it was the next portion to what we was going over today. So is that going to be like optional for next time if we want to like come on and go over that all together, or you just going over that separate?
So the question is, what we did today, is that optional?
No, because on what we did today, it looks like at the bottom of it was a couple more slides. So does that have any, is that the same material or is it like a different material?
So the bottom there, that is all of the bones. I don't think it's as important for me to physically like walk you through the bones as it is to show you the muscles.
Okay.
So if you want, you can stick around and I can like point to things and say this is what it's called. But I will give you labeled diagrams, and you guys have those lab videos where I take the skull and I walk you through the skull. So I think unless you guys have a differing opinion on this, I think that is probably adequate for learning the bones of the skull. Again, I'm open to feedback on this. You can do whatever you need.
Okay. All right. Thank you.
All right. No worries. All right.
I have a quick question about the next practical.
Okay.
So you mentioned that after this practical, it was going to just be pictures of like diagrams, but I know you also put pictures of the actual models. So do you want us to focus on the actual models for the next practical? Okay.
Absolutely, yeah. So I gave you guys those pictures, and you guys have the videos of me walking you through those models. So unless unless your feedback says otherwise, I think that it's a reasonable jump to go from here's the videos, here's the pictures, here's another picture of the same model. What is the structure?
Yeah.
Okay. Yeah.
Thank
Same format as before. I will up the time a little bit, but in general, do you think that was a fair assessment? Right.
It was fair for like the leg models and everything. I kind of wish I had the chance to like be there in person to look at the spine and things like that, because that was so far back. But other than that, the rest of it was good.
For me, the exam was fine, but for the practical, I think instead of like a minute, it should be just a little bit more, because it takes longer to type than it would to just write something down.
Okay.
Yeah.
Also, if you have the opportunity, maybe if you could put like 2 pictures for each model we're looking at, because sometimes I know one of the leg models, like the leg was stretched a long ways, like coming as if like it was kicking towards the camera.
Mm-hmm.
And that sometimes, like, I get a little disoriented looking at that. So you can have like one. I know the thing that we're supposed to look at was closer towards towards me, so that makes sense. But if you put like one like that and maybe one from like closer to a top view, just so I could get oriented with them. Because usually when I'm there, I can like move the muscle or move my body around. So like an extra picture for the models, I would really appreciate going forward if you can manage that. I don't know how hard it is to upload the pictures.
It's time consuming, but worth it. I know you guys are working your butts off as well, and probably spending a lot more time, than you otherwise would be. So that is perfectly reasonable, and I can make that happen.
Thank you very much.
Yeah, no worries.
Also, I don't want to jump in on anyone else's questions, but the slide 7, muscles of the anterior neck, it says. Do you still have that up with all the drawing you did on it?
I do.
Do you mind if you put that on the screen real quick? That's the only slide I didn't take a picture of.
Yeah, same.
So it's like a gap. Perfect. Thank you.
No worries. Yeah, and there's really only a couple here. The masseter, the digastric, sternocleidomastoid, and platysma, of course, we can't see, but we know it's there. And it's not on any of the models either, which is kind of a bummer.
That is a bummer. Excellent. Thank you very much.
Sure.
Like I have a Microsoft Word document open with all the pictures of all the slides you drew on.
Nice.
And it's like all of them in a row, and so that one's just not there.
Oh no. Well, there it is.
Yeah. Let's crop this bad boy and put it in.
Since we're here, here's approximately what you're seeing. Right, so this is the masseter, the sternocleidomastoid, and way under here is the digastric. Right, note that there's no platysma over the front, but I would pretty much just ask about that as like, what is the blanket muscle or the most superficial muscle that's blanketing over the anterior neck? Something like that.
Oh, sorry to cut you off. For the exam, the open-ended part.
Yes.
Next time, can you just like, I don't know, because you know how it said 1, 2, 3, and then it had like ABC going on and structure function? That really threw me off. I had to ask my dad like what part of what was what, asking what, because I wasn't sure if you were saying like either I put the answer form in like 1, 2, 3, or if I use ABC.
Gotcha.
Yeah.
Okay.
But my dad said you were like for the ABC, you were that was just for question 3.
Right.
Okay.
Yeah. So that's good feedback. I will try to be much clearer about that in the future. It's been a little bit interesting to convert the normal test style to online, as you might imagine, and so sometimes it just doesn't translate very well. Sorry.
Yeah, and it's kind of like hard to email you because I try to do that, but that consumes time whilst I'm trying to take the exam at the same time.
Of course.
Yeah.
Of course. So it's not a perfect system, but hopefully we'll get the hang of it by the end, right?
Yes.
I just wanted to say, I think that the fact that you were able to give us like the whole weekend to work on the open-ended and then just the multiple choice was timed, it was really beneficial. Like you had time to sit back, look through your notes, make sure you were answering everything correctly. And
Yeah.
it was really appreciated. I just wanted to let you know that.
Awesome. Thank you.
Amen to that.
Yeah, I also really, really like that too. Oh, and thank you for taking in like feedbacks as well, because that really helps.
Oh yeah, no worries. I know that this is a really strange situation, and I want to give you guys the opportunity to, guide your own education here. And of course, I don't really know what's working and what's not working. So really, I'm so grateful to you guys for coming this morning and being open about what you're thinking. So thank you so much. And I will do the best I can to make this as seamless and as educational, yet not stressful. I know it's inherently stressful, but try to reduce that as much as possible. So, hopefully.
What a unique skill set to put on the resume. Know how to teach class in the face of a pandemic.
Oh my gosh, it really is. Although now that's going to be on everyone's resume, so it's not really.
I'm good. She's gonna be in everyone's resume.
But I have my own YouTube channel now. Woo!
Oh, sorry. Quick question.
Sure.
Is there any news on the past no credit for health science classes yet, or no?
So that is a fantastic question. The program is actually meeting today to talk about how we're going to respond to that. My understanding in general is that the pass no credit would be a decision on the student's part, and there's still some time to make that decision as long as the program allows it. And so the concerns of the program is that a pass isn't going to be enough to get you guys into grad school. It's not going to be enough to move on to the next level, to AMP2 and to any other classes that require this as a prerequisite. And so we think that maybe that would be doing you guys a disservice if we offered that as an option. So again, we're going to come up with some very clear decisions and guidelines about that today, and I will send that out to you as soon as I have that information. But in general, I think that you guys are doing really well. No one's in danger of failing. Like, you guys can do this, and of course, I am absolutely taking into account the fact that this is a really weird situation, and we're not here to discuss concerns as much as we otherwise would be able to. And so hopefully, not that it'll be easier, but just I'm trying to be really understanding of what everybody's going through. So again, to summarize, I will give you the absolute decision as soon as I have it, so later today. And from there, we can talk about what's happening.
Excellent. I think that's everything I wanted to ask and everything I wanted to talk about. But thank you very much for the lecture. Nice to see you, some people again. Interesting. Almost forgot what your new face looked like. But so this was a very timely lesson. So yeah, thank you very much, and see you guys next time we do this.
Indeed. See ya.
Thank you very much for the lecture. Although I'm gonna have to just go over it just to write down notes because I was just trying. Oh, yeah, sorry. it doesn't work on computer. I noticed the link doesn't work on a computer, for me at least.
Really?
Yeah.
Interesting. I can check into that for sure. I do have, so talking through you, my personal computer doesn't have a camera, but it worked on that. So I guess I can check into that to see if there's, some kind of issue going on with that.
Yeah, because I was on it like 8:25 and it said launching, which makes sense. But it was like 8:35 and it was still launching, and I decided to use my phone and you were already like talking.
Huh.
And I was like, oh.
Sorry about that. Yeah, I will see if I can make that better for next time.
Anyway, thank you for the lecture.
No worries. Thank you for coming.
With the fourth exam, is it just the newer information that we're learning now? It's not everything, right?
Correct. Yes, it is cumulative. Thank goodness.
All right.
What was that?
Exam 4 is not cumulative, so it's everything from today on. Right?
Is that supposed to be like the final?
Yes.
Oh, okay, cool. Thank God.
I'm assuming upper limb, brain, and joints are going to be on the third practical as well, and then those are going to be also on. Did we do joints in the last exam?
So there is a list of terms for, here we go, for the practical exam. All right, so that is what this is right here. It starts with, let's see, the upper limb bones, the upper limb muscles, and the knee joint. And I know this seems like a random grouping of structures, but that's just how life has worked out this semester. So yes, all of these terms are on the lab practical, which will be structured in largely the same format as the last practical. Those terms we learned 2 weeks ago in theory. These terms we learned yesterday in theory. And then the last set of terms is for next week, the brain and the special senses. And so on the lecture exam, it will be this stuff, the brain, special senses, head bones and muscles, and not any of these things.
Okay.
Right, so only the second 2 pages of that list.
All right. Thank you.
No worries.
And that's going to be what's on the lecture. Second 2 pages.
Yeah, so the lecture exam is just this page 2 and this page 3. For the lab practical, it's all of the head stuff as well as the arm and the knee.
Okay, and this is what's already uploaded, because I remember I see some of these. Is this already uploaded?
Yes, this is within the lab section.
Oh, okay, yeah. All right.
All right. Any other questions or need to see any other models or anything?
No, I think I'm good here. Y'all have a wonderful day. Be safe. And yeah.
You too. Thank you guys so much. It was good to see and hear and interact with you guys.
Good to see you.
Been good.
Thank you. Have a good day.
You too. See ya.